Dr. JJ, what are your fees, and does my insurance company cover any of the chiropractic and/or massage therapy that you offer?
As far as things go with our fees and insurance coverage, that's a question that is often asked, and when it comes to it, we are versatile in every single phase of that. First of all, myself, I am a provider for United Healthcare, Medicare, Cigna, Blue Cross Blue Shield, Kaiser, almost every single insurance plan I am an in-network provider for. So absolutely we accept health insurance. The only one I am not in-network with is Humana and Aetna. Typically, Aetna has out-of-network benefits, which we definitely don't really show much of a change as far as the fees go with their in-network. But I also have one of the doctors that works with me is an Aetna provider as well. So we pretty much have every health insurance covered. If there is a health insurance somebody has and they're wondering if they can find a chiropractor or anybody that does those services and can provide them those rates, we would be the office. And if it does have chiropractic coverage, one of us would be able to provide them those rates. I try not to focus on that, though, to be honest. I really do try to focus on the patient, and if it were a fee, and if in a perfect world I could, I would rather charge cash fees. And typically people that don't have insurance or don't have insurance coverage for chiropractic, we charge $40 an adjustment. It's a standard fee. For families that try to undergo care and want their whole family on care, which we highly recommend and encourage, why leave the other family members behind when you're getting adjusted? We typically lower the rates if there's no insurance to be had, knowing that that's a larger portion of the income and expense than somebody that doesn't have a family and children that they're taking. So we lower those fees incrementally according to how many people in the family are getting adjusted. The main point I'm trying to make there when it comes to our fees is that we are not insurance driven. When it comes to personal injury cases and auto accidents, we do not try to abuse in any way the situation. We handle it very short, very ethically. We typically don't even take on or look for any auto accident cases unless it's a current patient of ours, because we like to provide care without trying to get the finances and the insurance, any sort of problems of any kind. When we look at taking care of patients, insurance companies in the past have really put limitations on us. They've had max number of visits, they've had max dollar amounts, they've had huge deductibles. They've had a lot of obstacles that typically when you look at trying to get healthy and trying to get through your corrective care into a wellness phase and be healthy, the typical insurance plan does not help you do so. And so we actually, at this point, I do believe we are almost about half and half in both of our offices as far as people that actually use their health insurance and people that actually pay cash fees. We're trying to look to go even more into the people that don't need or use their health or insurance or don't have health insurance, because we really do see the difference in the patient, the value that they have for our services, and the ability for us and them to be able to experience the results that they can receive without having some sort of limitation that the insurance company puts on. So my answer to that question is yes, we do take every kind of health insurance that does have chiropractic benefits, and a lot of them do have massage coverage. In our office, some of the injuries that people go through really do benefit from a combination of chiropractic and massage therapy and or rehabilitation with passive modalities of muscle stim, hydrobed, and or stretching, strengthening exercises to recuperate those injuries. But also, we function and cater to the people that don't typically have the very nice insurance plans and typically are looking for health care and results without having to have an insurance company pay everything with a low copay. So we're all over the spectrum. Our typical fee is $40 a visit. And then from there, with different insurance plans, it's all broken down, and it is exactly as the insurance plan says. We follow the rules when it comes to those things and all the different rules that they have. We have a top-notch insurance department who is able to work with you for any questions We also have a new service online right now. If you ever have any questions about your insurance coverage or maybe looking into getting something, with a click of a button you're able to enter some information in, and we're able to give you advice and or verify your insurance at no cost and call you before you even were to commit to anything in our office.
Thank you, Dr. JJ.
You're welcome.